Hi, I'm Lynette Hickey, the Director of Student Placement here at Silver Oaks Behavioral Hospital.
I'm Thurpit Bajwa. I'm the psychiatric nurse practitioner here in our outpatient program as well as our inpatient area.
And I'm Samantha Garrick, the Director of Outpatient Services.
Thank you both for joining us today.
Thank you for having us.
And today we want to talk about a topic that's very near and dear to us, first line responders and healthcare workers. It is something that is a challenging job anyway, and we want to address the changes that are occurring during this pandemic. Thurpit, could you maybe tell us some of the challenges that frontline workers and healthcare responders might be having right now?
Sure. It is a very stressful situation at this point. The first line responders are in a stressful position. They're taking more calls and they're trying to prep in a different way that they probably weren't used to. They're dealing with more sick individuals, both dealing with medical conditions as well as mental health conditions.
Could you maybe get into some of the warning signs that some of the healthcare workers and first line responders should be watching for?
Absolutely. So changes in their behavior, such as they're more irritable, they're not engaging in their normal daily activities that they usually enjoyed. There's anxiety, pacing around the house or around a certain area. Sleep is decreased or even increased. They have lack of appetite or too much appetite, something that's not usual for them to look out for.
Very good. Thank you. Mm-hmm. Sam, could you maybe share with us some ways to manage the stress and warning signs that Thurpit had referenced?
Yes, definitely. I think what's really difficult right now is the things we would normally recommend to manage stress and trauma from kind of work or things that are going on aren't things we're necessarily able to engage in at this point.
Sure.
So normally we would talk about connecting with other people,
Definitely.
maybe establishing routines, things that are just more difficult right now because of the precautions that we're taking overall. So in order to manage the stress, we have to find kind of ways around that, ways to stay connected to our family, to our friends, maybe even coworkers. I know that one of the things that has been increasingly difficult for people who are working on the front lines with COVID patients is that feeling like they can't be connected and near to their families.
Very true.
For fear of exposing them to what they're being exposed to. And so with that, we work on trying to establish things in our routine that feel close to normal. How can we have positive interactions where we're still keeping a safe distance and taking precautions? That can be things such as using Zoom to talk to family and friends that aren't local, doing activities that maybe you're not super close, but you're together. And for some individuals, that may mean reaching out for professional help. Here at Silver Oaks Behavioral Hospital, we do offer free assessments 24/7 so that an individual can come in and see what type of help or assistance they might require. Depending on what they're dealing with, that could be inpatient. If they're having thoughts of hurting themselves or someone else, it could be an IOP or PHP level of group support.
Okay.
One thing I'm really excited to announce today is that we will be starting a support group for frontline workers and first responders that will take place weekly via Zoom. It is available for these individuals to have a place to kind of reach out and connect to other people who understand what they're going through, kind of have some validation around that, but also to trade ideas on how to manage, what are people doing that are successful, what are some other things we can try that will be offered free and weekly, and anyone who wants to participate in that can call Silver Oaks to get the information or check out our website.
That's a really great idea. I'm really happy that we are able to offer that here at Silver Oaks, and I really appreciate both of you coming and joining me today. And we definitely encourage you to reach out, support each other, and together we will get through this.
Thank you.
Thank you.
Thank you.